Hello, good morning to everyone. I'm really glad to have possibility to give you one lecture about one new Fanta system. This is a new system called Rising. For those who listen to me for the first time, I live in Belgrade. Belgrade is the capital of Serbia, wonderful town, and I hope one day you will come to visit our town and to experience our nightlife. We are very famous about that. And I work in a school of dentistry in 𝗥𝗶𝘀𝗶𝘴. We are the first private school of dentistry, and we are not small school. Every year, the new 77 students became our students, and this is very nice. And I'm a full professor. I'm specialist in dental restorative dentistry and endodontics, and I'm the head of department of endodontics in our clinics. You can see in our school of dentistry, we use Fanta's microscope in our everyday practice, endodontic practice. Also, I'm a call for Fanta, and more than 5 years with my very nice and good friend from Prof and 𝗥𝗶𝘀𝗁, we have been organized more than 500 courses in rotary preparation, and so many dentists from Serbia and region start their preparation with Fanta systems. And of course, now my topic. Okay. In our everyday practice, in our endodontic treatment, we really want to be successful. But the question is, how can we measure our success? Success is when we overcome a complex tooth morphology, when we do good preparation, and when we see a nice obturation feeling on the X-ray. Success is a patient without symptoms. Success is healing of periradicular lesion. And I can say success is really longevity of endodontically treated tooth. But if we want to be successful, we need to be minimal invasive. And minimal invasive concept is one, I can't say new concept, but we have so many benefits about minimally invasive endodontic. At first, we preserving natural tooth structure and reduce the risk of fracture and promotes the longer lifespan for the treated tooth. We can be with minimally invasive concept more conservative, and we can have greater efficiency because we are focused on preservation, but we also promote efficiency, especially with, inside the group of the younger practitioners who just started to do endodontics. It's very important that when we talk about minimally invasive endodontic, we have some key principles and goals. One of the most important key principles is dentin preservation. Of course, we need to be conservative in our access, we need to do appropriate shaping, and we need to enhance chemical disinfection. And we can achieve all these goals supported by technological advancement such CBCT, surgical microscope, and advanced rotary instruments. If we use CBCT in our endodontic practice, we can understand the complex root canal morphology. With surgical microscope, we can see what we do, and we really need advanced rotary instruments to do our canal shaping. And according to that, I really want to presenting you one new Fanta system for preparation, for root canal preparation. This is a Rising system, one new and unique Fanta design. This system, you see, consists of 5 file sequences, and have so many advantages. First, we can do minimal invasive shaping. These files have fixed taper and variable cross-section. You see, we have a different color, and we have different nickel titanium phase in every file with a specific technological proceeding. We have specific cutting angles to improve cutting efficiency. We have really nice and deep flutes for maximum debris removal. And in this file system have specific design file at apical portion for confit perfectly. This is very important. Why? At first, when you have good apical matrix, you can push your gutta-percha beyond the apex. And this is the first. And the second, when you have good confit perfectly, you have good tuck back, and then you can pull out your gutta-percha during the different obturation techniques such vertical compaction or called lateral condensation. And you need to understand that this system has the specific gutta-percha point for fitting. I will talk about this later. I said already that this file have variable cross-section, and that means that instead of having the same shape from tip to handle, these files change their cross-section at different points. And because of that, we have increase of cutting efficiency in the apical third and improved flexibility in the coronal portions. I give you, just for example, 3 different cross-sections to see what that means. But we have so many, I can say we have so many advantages because of that. When we have variable cross section, we have raising the cutting efficiency because the different diameter cutting the different part of the root canal. We have increasing resistance to fracture because the different cross-section reduce stress concentration on file, and we have very, very good shaping ability, and we can deal with a complex anatomy. And now I will show you sequences or the files from rising system. The first file is 𝗧𝗶𝘀𝗶𝘀𝗺. This is RR file. The second file is file for glide path. This is R1 file, the number 13, the taper 03. And after glide path file, we have 3 different files that we can use for shaping or shaping and finishing. We have R2 file, 2504. We have R3 file, 3004. And we have one very nice and unique file, R4 file, 2805 taper. This file called passage file, because in the different cases, you can use this file after R3. In some cases, you can use before R3, and sometimes you can skip this file. Every files use in continuous rotation with speed of 450 RPM and 2.5 Newton. Okay. The first file is 𝗧𝗶𝘀𝗀𝗺. You can see this is short file called RR, and very nice file for pre-fluorring. And specific of this file is file have semi-active tip. It is very effective file, and you can use this file for removing gutta-percha in some cases. And now we have a question, can we skip this 𝗧𝗶𝘀𝗀𝗺? Can we do our preparation without pre-fluorring? Okay, in some cases you can, but why? Because you have so many benefits of pre-fluorring of a canal. At first, you have, when you pre-fluor the canal, you have easy access to the canal because you eliminated the constrictions caused by the position of tertiary dentin. When you use 𝗧𝗶𝘀𝗀𝗺, you remove the most of the necrotic tissue and microorganisms. You made the larger space for irrigants with better penetration into the side canals, and because of that you have better irrigation, better cleaning, and better disinfection. You can reduce risk of detritus extrusion and inoculation of pathogenic bacteria into the periapical tissues. And of course, when you do pre-flaring, you made a straight line approach to apical third. You have safer maintenance of working gland because studies shown that if you measured working gland before and after preflaring, the numbers are not the same. You prevent bending and reduce physical stress on the instruments, and you reduce risk of errors during preparation. And last but not the least, significantly it increased tactile sensation and certainty for determining apex constriction and eventually achievement apex patency. We have so many evidence-based studies showing that really it's very useful to do preflaring. Do not skip this file. I give you one clinical relevance from one study. Said that cervical preflaring assumed particular importance previously to the root canal preparation because it minimized the occurrence of operative accidents and permits more accurate determination of working gland and the apical diameter, very important things. Okay, after after orifice shaping, we measure our working gland, and then we can use the next file. This is R1 file for glide path. Number is 13, taper 03. You can see the file was made from gold specific wire, and it is soft. It can pre-bend, it is Martensic file, but inside of the canal, the file can change according to shaping procedure. Can be very flexible and can be very soft if you need, but can pass through the calcification. It is very, very important. What is glide path? By definition, glide path is a smooth, reproducible passage from the root orifice to the physiological terminus. And now we know that we have a recommendation about glide path before rotary canal shaping in order to remove interferences, respect the original canal anatomy, and reduce incidence of procedural errors and apical extrusion of debris. I give you one, literature review. And we can conclude that creating a glide path reduces root canal transportation, especially with the rotary method, with continuous rotation. Glide path reduces immediate postoperative pain and improve cutting ability of the files. And if we thinking about that, what kind of file we can choose for glide path, the best file for glide path are reciprocating or heat-treated files, very important. Look at this, heat-treated files such as our R1 gold wire. This is heat-treated file. When we're done with the glide path, when we made glide path, then we can shape and finish our canal. The next file is R2 file, number 25 and 04 taper. I need to recapitulate that the apical design is specific. We can make a good apical matrix. The cone fitting is excellent, and you can finish with this file, but then you need to use the specific R2 𝗥𝗶𝘀𝗺 point for obturation. If you have a very large canal, you can go to R3 file, number 13, and the 0.4 taper, very nice gold file. And in some cases, you can use the passage file. R4 file is number 28, 05 taper, very specific because he's more flexible than R3. And in some cases, when you have some complex anatomy, curvature, or C-shaped canal or something, you can go and reach the working gland with R3. You can use R4 before R3. This is the use. And sometimes you can use R4 after R3. And I need to say some about durability of this file system. We know that in 1992, all the files are made by normal nickel titanium wire. This wire was very, very rigid. And Fanta, for their systems, use three different wires, that is AFL, very flexible wire, AFR, more flexible than L, and we have AFH, extremely flexible wire. But Rising system has made from the one new file. This is AF profile. Today, I will not talk about, the specific of the wire, but I can say because of that specific, very flexible and very new, file, this rising system can be the system of longer durability. And now I will talk about the protocol. How can we use the different files for different cases? If you have easy canals, like straight canals, single-rooted tooth, the canals without curvature and premolars, then you can handle with this morphology very easy. At first you do the coronal pre-fluorring with orifice shaper in continuous motion, and the objective to enlargement the coronal third to facilitate straight line access and reduce coronal interferences. After that, you can irrigate the canal. No, you must. After that, we do the canal negotiation with 𝗖𝘀𝗀𝗺 to achieve full working length and confirm apical patency. And after that, we go to shaping our canal with air2. We skip glide pattern in these cases. We don't need glide path because this is very easy morphology. And after air2, you can use air4 and for final shaping and finishing. And very important, air2 and air4 you need to use in gentle in and out motion. And the objective of final shaping and finishing is final enlargement and refinement of canal preparation to working gland. I need to say that you need to use the air4 𝗥𝗶𝘀𝗀 and match this 𝗥𝗶𝘀𝗀 with this file. Okay. If you have medium canals, like in premolars, molars, or canals with little curvature, then you can use you need to use glide pattern after, orifice shaping and irrigation with sodium hypochlorite. After canal negotiation with 𝗖𝘀𝗀𝗺, in wart widening motions, you measure the working gland and do glide path preparation in gentle in and out motion. Objective is to have mechanical shaping to the full working gland to make the tunnel between the orifice and the physiological foramina. And after irrigation, you can finish with air2 instruments, and you need to choose air2 𝗥𝗶𝘀𝗀𝗺 point with a good confitting. If you deal with moderate canals, like curvature canals, molars, premolars, and moderate canal anatomy, then after coronal pre-fluorring and irrigation, after you're doing the canal negotiation and measuring of working gland, you need to use glide pattern R1. After that, you can shape with R2, and after that, you have the final shaping and finishing with R3 instruments. Very important is that motion, gentle in and out motion to produce during your preparation. After that, you need to choose R3 𝗥𝗶𝘀𝗀𝗺 with a good confitting in app. If you have hard cases, you can use all these phases, orifice shaper, okay, negotiation, working gland determination, glide path making, then shaper R2, and after irrigation you can choose based on the size of the canal and complexity. You can choose R3 or R finishing. And if you really have the extreme, cases, like canals with very large curvature, extreme curvature, or double curvature, or C-shaped canals, you can use all these files. But look at this. In these cases, the passage file R4 you will use before the R3 file. Everything else is really the same. And now I will show all that. I will show to you all that on the plastic model. At first, we do the negotiation with watch binding motions with the C plus or C or K file. Because I love to, introduce myself with the canal morphology based on the X-ray, the intraoperative X-ray. And after that, we will use orifice shaper in gentle, in continuous rotation, very easily, very effective, with semi-active tip. Only 2 to 3 movements. Very nice. You see how we enlarge the corner and the beginning of the middle part of the canal. And after this phase, of course, we do irrigation with specific endodontic needles for irrigation. It's very important because only these needles with this gauge you can put this needle down to the apical third. They're laterally perfored, and you see the irrigation solution go coronally, not beyond the apex. The next phase after working leg determination is, of course, glide path. I have very narrow canal in this model, and you see the gentle in and out movement very easily and very nice. After irrigation, we can use the next file. This is the first file for shaping. This is R2 file. Please do not recapitulate like me in this case. This is the model. I just want to do the better irrigation. And now I will use the R2 file 2504 in gentle in and out motion. And you will see very easily I reach the apex, and this is very narrow model, very narrow canal. And after this model, I will repeat my irrigation, of course, with sodium hypochlorite. And I need to show you that I can't remove all debris for the apical third. I do a recapitulation, and after that, I will change my file, and I will finish my preparation with R3 file, 30, number 30, and 04 taper. These files are very effective, very good cutting ability, and very flexible. And I will show you very nice motion, you see, and very easily I can reach the working line. And this is very important part because you see I can remove all the debris from the apical third with my irrigation needle. And because of that, I recapitulate. Because of that, in this in this case, I will show you how I use my Active Pro from Fanta Dental. And I do the ultrasound activation of irrigation. It's very important to have prepared canal. And very important is to have possibility to look now, sorry. After irrigation, I remove all debris from the apical third. It's evidence-based that ultrasound irrigation is the best way for activating irrigation. We have so many, like laser or sound activation or negative apical pressure or manually, but ultrasound is evidence-based the best because of their streaming and their cavitation. And now, at the end, I just need to confit with R3 𝗥𝗶𝘀𝗀, and I will show you the nice confitting, because I can push the 𝗥𝗶𝘀𝗀 beyond the apex, and I can pull out 𝗥𝗶𝘀𝗀. I have good 𝗥𝗶𝘀 phenomenon. This is very nice, and this kind of canal are very easy to obturate with a single cone technique, and the best way to perform single cone technique is to use 𝗥𝗶𝘀𝗀 point with calcium silicate based sealer. But if you have some difficult, I said difficult complex anatomy, the very, very large, oval canal, you can't perform the obturation with the single cone technique. You need to use advanced techniques such as warm vertical compaction. I will show you how to do this. You need to choose 3 different plugger for coronal part, for middle part, and for apical part, or apical third. In this case, I didn't use the sealer because visibility, of the technique. I don't want to everything, will be caught, but by sealer. But it's very important to find the 3 different plugger to fit to different, different position in your root canal. After that, I will show you. I do preparation with rising. I finished with R3, and this is R3 cone. You see fitting. I can push beyond the apex, and I have a good 𝗥𝗶𝘀. 𝗥𝗶𝘀 is very important because I don't want to pull out my 𝗥𝗶𝘀𝗀 when I will warm with e-heater. I use Fanta e-heater, and I will show you step by step. At first, of course, in practice, you will put the sealer. I need to notice that you can use the calcium silicate base sealer with a warm technique. You can choose some other sealer route. And at first, I will cut my 𝗥𝗶𝘀𝗀 at the orifice with the heater. And after that, I will plug with the larger plugger coronally in the apical, you will see in the apical way. First cutting. Now I will soften the 𝗥𝗶𝘀𝗀𝗀 coronally, and then I use my plugger, the first plugger, the largest, the biggest plugger, to condensate this orifice and coronal portion apically. Okay. When I do the coronal and in the middle third of the canal, when I do condensation, I have the last part, the apical part. You see, I put my e-heater, but it's very important. The only 4 seconds is the time you can be in the canal, because you have the negative influence on periradicular tissues by heating. And after softening the 𝗥𝗶𝘀𝗀𝗀 in the apical third, I use the smallest plugger and do the vertical compaction. When I obturate the apical third, okay, I can, put injectable 𝗤𝗶𝘀𝗁, softened 𝗤𝗶𝘀𝗁 in the middle and the cornal part of this tooth. The next question is, in what cases I can use the passage file before R3 file? This is the cases of the really complex morphology. I will show you one premolar, upper premolar, with the two canals in the buccal root. You can see negotiating with C10 file, and I will put the K file 15 in the palatal root. Very nice. And now you can see the protocol. The first, I used 𝗧𝗶𝘀𝗶𝗴 in continuous motion, only 2-3 times. And after that, I measured the working gland. In the experimental condition, I measured when I see the tip, of the K file beyond the apex, I short this length for 1.5 millimeters to know I have a good apical matrix. The next file after working gland measurement is file for glide path. This is R1 file, very nice, very flexible, Mertensic file. After irrigation, I can use R2 for shaping. You see very gentle in and out motion. Very nice. I reach the full working gland. After irrigation, I use in the buccal roots, the buccal two canals, I use the more flexible file, R4 file. It's more flexible than R3. I will finish my preparation with R3, but I need to enlarge my buccal canals with this passage file. And after that, I have, the last file, R3 file. 3004, confitting with R3. But in this case, it's because I enlarged my canal with 0.5 taper before, I will use some, technique with a warm, softened 𝗤𝗶𝘀𝗁 form. And now I will present to you one clinical case, tooth 36, first left lower molar, and with the diagnosis of irreversible symptomatic pulpitis. Okay, I can show you with the Fanta dental microscope how nice and good I look. This is the magnification 5, I think, because I don't need to see something deep inside the canal. This is very ordinary morphology, and I do irrigation, and after that I will show you how I use my protocol for this kind of molars. You see the patient on this tooth have a metal ceramic crown, and at first I do the pre-fluoric with 𝗧𝗶𝘀𝗶𝘴. Okay, first the second mesial canal, but I will show you only one canal because of the position of the microscope to do not change my angle. And after pre-fluoring with the 𝗧𝗶𝘀𝗶𝘴, I irrigate with sodium hypochlorite, a lot of sodium hypochlorite. You can see how I remove all the debris from the canal. And after the working gland measurement with, apex locator, I will take my instrument for 𝗥𝗶𝘀𝗀. This is R1 instrument, gold wire, 1303, to make nice smooth tunnel from the orifice to the physiological foramina. Very nice in and out motion, and I will show you now how smooth looks the, this canal. Very easily and very fast, because the speed is 450, RPM. And after this file, R1 file for 𝗥𝗶𝘀𝗀, I use the file, for ending my preparation. This is R2. I will finish my preparation, but now you will see how nice kind of looks. And this is the last file for shaping and finishing. I will match this, preparation with 𝗧𝗶𝗀𝗀𝗀 cones. You can see how nice and easily I reach the apex. And now you can see how smooth looks the canal orifice. Irrigation, of course. I can show you in this video all the protocols, but after R2 file, I do the final irrigation with different solutions and with ultrasound activation of irrigation with 𝗥𝗶𝘀𝗀 by Fanta. And this is how it looks after, the preparation and after the single cone obturation technique with calcium silicate base sealer. One more case. This is case of retreatment case. At first, I use the orifice shaper. I already told you that this is very specific file with a semi-active tip. And in some cases, you can use this file for beginning of retreatment. And this is this case. After orifice shaper from rising system, I use the Fanta RF retreatment file to, remove all the 𝗧𝗶𝘀𝗀𝗀 and sealer from the canal. And after the establishing working gland with the, of course, C+ file, I do my preparation with a 𝗥𝗶𝘀𝗀𝗀 R1, and after that with a R2 file, I shaped and finished my preparation. You see, in this case, I skip really orifice shaper in preparation because I use orifice shaper for 𝗧𝗶𝘀𝗀𝗀𝗀 removing. And you can see the final, after single cone obturation technique with the calcium silicate base sealer. One more patient with 2 premolars, second premolar, first upper premolar and the first lower premolar. In both cases, I use the 3 file, first orifice shaper. After working gland determination, I use 𝗥𝗶𝘀𝗀𝗀𝗀, 1303 in gentle motions. And after that, I finish my preparation with R2 file. I choose my R2 𝗧𝗶𝘀𝗀𝗀𝗀 cone, perfectly fitting, and you can see the final result of this preparation and obturation. For the end, I can only tell you, rise your everyday endodontic practice with rising system. I hope you will be satisfied. Thank you very much for your attention.